Hi, my name is Beyonce Henry, and today I'll be giving a presentation on advanced directives. What are advanced directives? Advanced directives are legal documentations that gives you specific instruction regarding your plan of care. It's an individualized plan that takes into account a patient's values, beliefs, and preferences. It is implemented at a specific time when a patient is unable to speak for themselves and they're able to say beforehand what type of medical treatment they will want. How can they get this document? They can get it from the healthcare facility they're in. Also, they can get it from their state attorney general. Also, they can go to uh, a agency that can help them with the documentation. Examples of advanced directives. The most common types is a living will and a durable power of attorney. Other types include a do not resuscitate, a do not incubate, and a do not hospitalize. Additional advanced directives include physician orders to life sustaining treatment and organ donation. Evidence based article. Advanced care planning. Advanced care planning is for all people. It's not just subjected to a person that's receiving uh, treatment for a terminal illness or has pre existing conditions. It is for everyone. This can be planned way in advance, like 20 years in advance, or even planned now. It just all depends on the patient's preferences. Some advantage of this is that the patient has autonomy in healthcare decisions, reducing the burden on their family, providing clear instructions, and avoid unwanted treatments. Some disadvantages include emotional difficulty, need for updates, and medical and legal misunderstanding. BS and Essentials, the two that I chose that goes along with advanced directives are patient-centered care and interprofessional partnership. With patient-centered care, it focuses on an individualized plan of care, and some examples of that is get it done straight when that patient is admitted. Also, having it when the patient has a terminal illness or even like a pre-existing condition. Keeping the patient in the center of the care helps the care team kind of base their care around the patient's wishes. Interprofessional partnership, it just involves collaboration with multiple people. It involves collaboration with the patient, collaboration with their care team, and collaboration with the family. Houston competencies, the two that I chose that goes the most with advanced directives is informatics and patient-centered care once again. Informatics, it helps with you identifying that important information within a certain healthcare system, whether it's Epic, Meditech, to help support the patient care. And usually, advanced directives are documented in that database. And also, you will find certain consent forms in case they want certain treatments or certain procedures done to take life saving measures or even to just remove something that is life threatening. Patients in care, that is so important in all aspects of care because you want that plan of care to be individualized, and you want it to elicit and express the patient's values and the patient's preferences, and you want that ingrained throughout your plan of care. And as I said, some examples of that is putting your patient's wishes, putting your patient's beliefs, and just putting your patient's preferences into the plan of care because it is their plan of care. It's not yours, it's not anybody else's. And they will want to get the treatment that they will want. And my reflection question. A patient comes in for a scheduled procedure and is awake and alert and information regarding their plan of care was discussed prior to the procedure. How would you respond if a patient's family member pulls you aside to discuss care planning of the patient and they mention that the patient would discontinue all care? These are my references, and thank you for your attention.